Hey everyone, I am here with the Med Hub. We all know how important toilets are for, well, obvious reasons. But did you know the type of toilet you use could actually be impacting your health? We're talking about the battle of the bowels. Pan toilets, also known as squat toilets, versus the Commode toilet, the throne most of us are used to. While Commode toilets are the go-to in many parts of the world, they might be coming with some hidden health risks that nobody told you about. So, if you're ready to dive into the surprising world of toilets and discover how this everyday fixture might be affecting your well-being more than you realize, stick around. And don't forget to hit that subscribe button and turn on notifications so you don't miss out on any future health tips. Let's talk about something nobody likes to discuss. Constipation and hemorrhoids. We've all been there, right? That uncomfortable feeling of not being able to fully empty your bowels. Well, believe it or not, the way we sit on the toilet could be a major contributing factor. When you sit on a Commode toilet, your body is positioned at a 90-degree angle. This might seem natural, but it actually kinks the colon, making it harder for stool to pass through. Think of it like trying to squeeze toothpaste out of a tube that's bent in half. Now imagine squatting instead. Squatting straightens out the colon, creating a much smoother pathway for those bowel movements. Studies have shown that squatting can significantly reduce straining, which means less pressure on those delicate veins in your rectum, great for preventing hemorrhoids. So, if you're constantly battling constipation or struggling with hemorrhoids, your toilet might be the unexpected culprit. Using a footstool while sitting on a Commode toilet can help mimic the squatting position and improve your bathroom experience. Did you know that the way you sit on the toilet could potentially increase your risk of serious colon diseases? Studies have shown a possible connection between improper bowel habits and an increased risk of conditions like diverticulosis, where small pouches form in the lining of the colon. When you don't fully empty your bowels regularly, waste can build up in the colon, putting pressure on the intestinal walls. Over time, this pressure can cause those little pouches, called diverticula, to form, which can become inflamed or infected, leading to diverticulitis. Adopting a healthier toilet posture, whether it's squatting or using a footstool, can promote more complete bowel movements and reduce the risk of waste buildup in the colon. Let's talk about something that doesn't get enough attention: pelvic floor health. This is especially important for women, but men, listen up too, because a healthy pelvic floor is crucial for everyone. Your pelvic floor muscles are like a hammock that supports your bladder, rectum, and uterus in women. When you sit on a Commode toilet, you're not engaging those pelvic floor muscles as much as you would when squatting. Squatting requires you to activate those muscles to maintain balance and control. Over time, constantly sitting on a Commode toilet without engaging those muscles can weaken your pelvic floor, increasing the risk of issues like urinary incontinence, fecal incontinence, and even pelvic organ prolapse. This is especially concerning for women who have given birth, as pregnancy and childbirth can already put a strain on the pelvic floor. But don't worry, there are ways to strengthen those muscles. Incorporating pelvic floor exercises like Kegels into your daily routine can make a huge difference. And yes, you can even do Kegels while sitting on the toilet. Just squeeze those pelvic floor muscles as if you're trying to stop the flow of urine, hold for a few seconds, and release. Remember, a strong pelvic floor is essential for bladder control, sexual health, and overall well-being. Let's be honest, public restrooms can be a breeding ground for germs. When you sit on a Commode toilet, your skin comes into direct contact with a surface that's been touched by countless people before you. Even if the toilet looks clean, it can still harbor bacteria and viruses that can cause all sorts of unpleasantness. We're talking about things like E. coli, streptococcus, and staphylococcus, just to name a few. These germs can lead to urinary tract infections, skin infections, and even more serious illnesses. Squat toilets, on the other hand, eliminate the risk of direct contact. And because there's no seat involved, there's less surface area for germs to linger. Plus, the squatting position itself can help prevent urine from splashing back, reducing the risk of contamination. Always use toilet seat covers if available, and carry a small bottle of hand sanitizer to disinfect your hands thoroughly after using the restroom. Remember, an ounce of prevention is worth a pound of cure. Ever feel bloated and uncomfortable after a meal, or struggle with constipation and irregular bowel movements? Well, believe it or not, your toilet might be playing a role in your digestive woes. When you sit on a Commode toilet, it can actually slow down digestion and make it harder for your body to eliminate waste effectively. When you squat, you're naturally engaging your abdominal muscles, which helps to massage the digestive tract and move food along. This squatting position also puts pressure on the rectum, making it easier to empty your bowels completely. Sitting on a Commode toilet, on the other hand, doesn't provide the same level of abdominal engagement or rectal pressure. This can lead to slower transit time, meaning food stays in your digestive system for longer, leading to bloating, gas, and constipation. Make sure you're eating a fiber-rich diet, drinking plenty of water, and getting regular exercise. And if you're feeling particularly sluggish, try using a footstool to elevate your feet while sitting on the toilet. This can help mimic the squatting position and promote a smoother, more efficient elimination process. Remember, a healthy gut is a happy gut, and it all starts with proper digestion. We've talked a lot about the impact of toilet posture on our digestive and pelvic health, but did you know that the type of toilet you use can also affect your overall mobility and even your risk of certain age-related conditions? When you squat, you're engaging a whole range of muscles in your legs, core, and back. It's like a mini workout every time you use the restroom. This regular squatting motion helps to maintain flexibility, balance, and strength, which are crucial for staying active and independent as we age. Sitting on a Commode toilet, on the other hand, doesn't require the same level of muscular engagement. Over time, this lack of movement can contribute to muscle weakness, stiffness, and even joint pain. Try simple exercises like air squats, chair squats, or even just holding a squat position for a few seconds at a time. By staying active and incorporating more squatting movements into our lives, we can improve our overall health and well-being. So there you have it, the surprising truth about toilets and your health. We've covered a lot of ground today, from constipation and hemorrhoids to pelvic floor health and even colon disease. While Commode toilets might be the norm in many parts of the world, it's clear that they come with some potential downsides. Squat toilets, on the other hand, offer a range of health benefits, from promoting better bowel movements to strengthening the pelvic floor, and even improving overall mobility. But let's be realistic, not everyone is going to switch to a squat toilet overnight. The key takeaway here is to be mindful of your toilet posture and make small changes to improve your bathroom experience. If you're using a Commode toilet, try using a footstool to elevate your feet and mimic the squatting position. Incorporate more squatting movements into your daily routine to strengthen your muscles and improve your flexibility. Ultimately, the best toilet for you is the one that allows you to have the most comfortable and efficient bathroom experience. What's your preference? Let us know in the comments. Don't forget to like, share, and subscribe for more health insights.